I'm Luis Rodriguez, and let's queer up the USA view. New York City Grand Marshals urge ban on hospitals that ended gender-affirming care for trans youth. Past and current New York City Pride Grand Marshals are urging Heritage of Pride to bar hospital systems that stop providing gender-affirming care to transgender minors from participating in the New York City Pride March on June 28. The letter, organized by Gender Liberation Movement, specifically names NYU Langone Health, Mount Sinai, and New York-Presbyterian. It also calls for excluding any medical institution that cooperated with federal efforts to obtain sensitive patient records of transgender minors. The petition has drawn support from 20 Grand Marshals, LGBTQ+ organizations, community leaders, and families of transgender children. Signers include Bowen Yang, Dominique Jackson, Peppermint, Jay Walker, Michelle Visage, T.S. Madison, and Jazz Jennings. Raquel Willis, a co-founder of Generation Liberation Movement, said, quote, "Each year we are tested against the values of our ancestors and transcestors during Pride. This year, when our vulnerable next generation of transgender and non-binary youth are being denied care, NYC Pride must hold the line and disallow hospitals that have unlawfully upheld hateful policies. Affirming families of trans youth are on the front lines of that fight against fascism. We owe it to them to defend their access and safety," end quote. The call follows growing pressure on hospitals nationwide over gender-affirming care for minors, including a criminal subpoena issued by NYU Langone seeking patient records. It's an ongoing where policies are being done by non-medical people, non-healthcare professionals, and then over trying to supersede parent rights and parent decisions over their youth and the health of their families. And then these institutions being held hostage by a government that wants to have an imposition on other people's lives.
Yeah, yep. Erasure. That's what it's about. I mean, to me, taking this kind of stand that they're talking about, it makes me think about the fact that, you know, Pride was a protest. Before there was Pride, there was protest. And so it's interesting to hear these people are protesting, and it reminds me, you know, what happened in the 60s in San Francisco and New York at the dawn of the gay pride movement. And in a way, I was thinking about that, the way, again, another protest when Kathy Hilton was supposed to be the Grand Marshal at the West Hollywood thing, their parade, and people spoke out. So I love this. I love this kind of activism, this kind of protest that's happening at a time when we know that Pride was a protest.
You can't support us and then act physically and emotionally and right there in front of us against us.
Yes, so speak up, right? Speak out.
I think two things can be true at once. I think what you gentlemen are saying is 100% right. Put your name on that protest, petition your government, petition people to get the heck out of your spaces if you don't want them there, you don't feel comfortable. So that's true. On the other hand, I think cynically, probably these hospitals might be saying, good, fine, no problem. We don't need to join this because it's putting a bigger spotlight on us with the Trump administration anyway. I don't think that there is anybody, I don't know, but I would think that there's nobody specifically hateful at any of these hospitals in New York City that want to deny people care. That's number one. So I think that they're between a rock and a hard place. They have to comply with certain things that are coming down from the federal government. This group of activists, they're not wrong, but I believe they have to understand the nuance of perhaps these hospitals want to be their allied, but just can't be the ally to the extent that the trans activists want them to be.
Right,
because that makes sense. I'm not
sure. What's the first do no harm? That's the medical thing. So of course they want to help people. But yes, their hands are tied by the government.
And I feel like these trans activists are 100% right to say, we don't want you marching with us, but to not personalize it and make it that it was a decision taken in a vacuum by these hospital administrations.
It's more administrative than the actual healthcare profession.
Absolutely,
right,
absolutely.
right.
So that's my
Because they're businesses, after all, hospitals too.
and I, to be honest, I don't know that they're going to be losing tons of money if people don't want to do their gender affirming care with them at their hospital.
Right.
And I don't mean that in a nasty, snarky way. I just mean that that's probably not their bread and butter.
Right.
It's probably a specialty service that they offer, which they should, because everybody is entitled to get the service that they need, especially if you're suffering.
Right.
I just think that there's some nuance here, and I feel bad that these trans activists don't feel comfortable having these hospitals march with them. But I don't think they should be punished either, because we're living in an unprecedented time. And, you know, they want to still be in business in the next 20 years. So hopefully when we get another administration that isn't so hateful, they can continue doing what they were doing previously. So I have some mixed feelings about that. And also, the one thing that I don't have mixed feelings about is that there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.